All right. Good afternoon. I'm Kelly Madewell. I'm the executive director of My Sister's Place, our domestic violence program here in Athens, serving Athens, Hocking, and Benton counties. Thanks for sticking around for a little bit. We have a wealth of knowledge and talent and skill up here on the stage, and I'm excited to just bring you a little bit about how Stephanie's story relates to some of the folks we serve here in Southeast Ohio. We have just a little bit less time than we were expecting, so we're just going to kind of jump into it. But first, if you could just say your name and your current position.
I'm Leah Schmelzenbach, and I'm the shelter program coordinator at My Sister's Place.
Hi, I'm Dr. Deardorff, and I'm an associate lecturer in the School of Communication Studies at Ohio University.
Robin Burrow. I'm the elementary principal in Meigs County at Eastern Local.
My name's Jack Freck. I'm a senior executive in residence at the George Voinovich School here at Ohio University.
All right, thank you. Leah, we'll start with you. You've logged over a decade of work with our community's domestic violence program. How does Stephanie's experience with shelters reflect the barriers that our own clients face?
Stephanie's experience highlighted a lot of very real and common barriers that shelter residents have to navigate. One thing that I'm constantly reminded of working at My Sister's Place is the reality of how very hard it is to live in a shelter setting on top of navigating all these complex systems that are needed to help folks move forward. The shelter Stephanie resided at had individual apartment-like spaces for residents to stay in. Some shelters are set up different, like My Sister's Place, where residents need to share bedrooms, bathrooms, kitchen, living room, the shared washer and dryer, shared fridge and freezer, and very little privacy despite our best efforts. Shelter residents have many appointments with many providers to keep track of. They're expected to fit in doing a number of things on their own and need to have very specific documentation to access support services, which sometimes can be very hard to obtain and can delay accessing these services. If a resident misses an appointment for any reason, they are met with further delays and often judged with an assumption that they must not care or need it. It is common for shelter residents to have complex physical and mental health concerns, as often low-income people in an abusive relationship are not able to access health care. Maybe they don't have transportation. Maybe they cannot miss a day of work or they will lose their job. Maybe their abusive partner will not allow them to attend an appointment. And maybe they've tried to set up appointments and they just can't make it. Most healthcare offices have a policy that if you miss 3 scheduled appointments, you are discharged from their care and can no longer access these services. We encounter shelter residents who are ill and need help, but finding a provider who can take them can take some time, and often getting an appointment, you have to wait a long time. After experiencing recent trauma and often having health concerns to navigate, shelter residents are still expected to keep up with everything. They have to fill out this application, attend that appointment, make this phone call, find income, and so much more, all at the same time. My Sister's Place strives to practice trauma-informed services, but not all agencies and staff have the same understanding or practice these supportive methods.
Thanks. I think it's also important to remember that domestic violence is the leading cause of homelessness for women. It's how many homeless stints start, as was the case with Stephanie. Karen, we'll go to you. You hold a unique perspective, having grown up with many of the challenges we're here to discuss today. And then you've had a long career at the university. Could you share some of your story with us?
Sure. We are storytelling animals, and I think Stephanie's book really spoke honestly about what women in her condition, live through on a daily basis. And I would start my story by saying, I don't know how many of you know Loretta Lynn and her song Coal Miner's Daughter. But I would tell you that I was born a coal miner's daughter, and I didn't grow up in Butcher Holler, but I grew up in Davis Holler. And so I lived without running water or indoor plumbing until I was 17. And that year I came to Hocking College I was in the police science program, and world changing, life changing. But there were many turns that got me to where I was. My parents had a 7th and 8th grade education. I was one of 4 children, only 2 who graduated from high school. Teenage pregnancy with my sisters, 15 and married with a baby on the way. Drug and alcohol abuse, cigarette smoking. And it took me a really long time to understand that for people in these conditions, cigarettes and alcohol are vacation, because that's the only vacation you ever get. And it is the only pleasure you ever get. And so when people judge for smoking or for drinking, know that that's their trip to Disney, because that's as close as they'll ever get. My father passed away when I was a freshman in high school and plunged us already in poverty into deeper poverty. My mom had a 7th grade education and had never worked. Luckily, a friend of ours who owned a gas station gave my mom a job pumping gas. She was a gas jockey, which for where I grew up, that was pretty cutting edge for a woman to be working in a gas station pumping gas. He later let her transition into a restaurant he owned as a dishwasher. It was actually, though, in some ways, the only time we had ever had a constant income in my entire life. Because my dad was the military, we got veterans benefits when he passed away, and Social Security for me. It's the first time we ever had a steady income in my life. I did not plan on going to college. That's not something we did in our family. And people who say, Stephanie mentioned, pull yourself up by your bootstraps. I'm here to tell you, you can't do it by yourself. You cannot, no matter how hard you work, no matter how much you desire to change. If it had not been for people in my life who served as anchors and as mentors and who believed in me, 2 high school teachers, a deputy at the Jackson County Sheriff's Office who said, let me take you to Hocking College and let you look at the police science program. If it had not been for a neighbor, Susie Martin, who drove me to the Chillicothe campus to take my ACT or SAT, I didn't even know what it was. If it had not been for those people, I would have never even gotten to college. Senior year in high school, no college prep classes, had not anticipated going. So you can imagine what a struggle that was for someone who had taken absolutely no college classes. I will say Hocking College, had it not been for Hocking, I would have never been poised to succeed at Ohio University. I was blessed to start at Ohio University in 1983. I finished my associate at Hocking, not police science, in higher business. I have finished 3 degrees, my bachelor's, master's, and PhD at Ohio University while working full-time and raising a family. And I will tell you that I live in a world where I'm a chameleon. I'm very educated and I talk usually pretty well when I'm here. But when I go home, I can't talk like this. Because if I talk like I talk in my classes, my family will say, who the hell do you think you are, little girl? My sister Sue loves to tell people I'm so dumb. It took me 30 years to get out of school. And so I think that the importance of what Stephanie gave us was she put a face to a story. And she told that story so well and so compelling that I hope that it helps you look at people differently. When you look at me, you don't see someone who was blessed because we had a 2-seater outhouse and toilet paper. You don't look at me and see someone who to this day, when they smell Spam frying, I get nauseous because we stood in line to get commodities when I was growing up so that we could eat. The smell of Spam really transports me back to some very unpleasant times in my life and makes me nauseous. And so you don't see that with me because, as Stephanie says, I'm one of the stories you like to hear about. I'm a success story, but there's a lot of effort and love and just mentoring and help along the way that's enabled me to achieve what I have. My family still very much lives in poverty. Even my sisters, their children, and their grandchildren. It hasn't stopped.
Thank you, Karen. Robin, schools are juggling so much. Many families in our region are struggling with the basics. Could you just talk with us a bit about what this looks like on a daily basis for teachers and other school personnel?
Yeah, I think when you think about education and educators, the big thing to remember, and all of you or many of you are experiencing now, our teachers go to school and they learn how to teach academics. They go to school and in some cases learn a lot about literacy or a lot about math, teaching. And we're learning more about trauma-informed practices, but I know, and I was a non-traditional student here at OU in the early 2000s. And my eyes were opened so much, transitioning from the classroom, the academic piece of learning how to teach, and going into the actual classrooms with children. And honestly, I had a child of my own even at that time, but I didn't understand all of the challenges that these kiddos are bringing to us every single day. And that their families are putting in their backpacks, even though the kids, it's not like a literal thing they're putting in their backpack, but they're bringing all of their family challenges with them every single day. And in Stephanie's case, I mean, my goodness, she was working so hard to pull herself up and her daughter up out of those challenges. And our families are experiencing that every single day. I mean, every single day at drop off, we've got car after car after car who they're dropping off their kiddos. They're racing off to a job. They don't have after school care, or they're a grandparent dropping off their grandchild because of whatever circumstance their family is in. They don't have after school care. There's nobody else there. And those families need so much support. They need so much love and empathy. Those kiddos are bringing so many different experiences to our classrooms that our teachers don't know how to deal with. My building, we have a lot of very veteran teachers. I have one teacher who's been there for 39 years and she's still awesome. You know, I mean, it's crazy, but think about that. When she went to college, my goodness, trauma-informed practices, what restorative justice, like that wasn't even a thing then. And so we're trying to educate our educators. We're trying to educate our student teachers, even as they're coming in, about trauma-informed practices and being empathetic and focusing on the children needing to be ready to learn before they can get started, even though they're not ready to learn when they enter the building. Having those transitional periods. I mean, I'm hammering that in the teachers' heads and they're sitting there saying, Robin, we have all of this academic stuff we have to cover, but you can't cover it until the kids are settled and safe and happy, fed, so that they can learn. So it's a real balancing act that's difficult. And I commend our teachers every single day. They are so patient and so kind. There are good days and there are bad days for all of us, but there are just challenges that our educators, you don't learn it in a classroom, you learn it on the fly in the classroom with your young kiddos or your high school kiddos, either one.
Right. Yeah, thank you. Jack, you've blessed our community with decades of service and advocacy. Could you share your observations about how our community safety net has changed over time?
Thank you. I also, again, want to thank the people who set this up, but I also want to thank all of you. I think we don't show enough appreciation to each other for people who have chosen to provide service to other people. And the people I include in that are also the maids and the people who are the nurse aides and the people who are waiting on us in restaurants. I mean, these are all people who provide service to all of us. And I don't think we show enough respect or appreciation for that or for each other. Because a lot of you you're only here because you care about people in your community. Because this book, this whole topic, rings a bell with you, something that you connect with. When I read this book, my first thought was, I've heard this story 1,000 times. I mean, 1,000 times, many thousand times. This is what poverty in Athens County is about. Her story could have been told by thousands of people today, all over Athens County, all over Southeast Ohio, all over America. And I thought she did an exceptional job of expressing, the fears that people have and the challenges. I started as a welfare caseworker. It'll be 50 years ago this fall. Now, I know there are people in the audience who are thinking, hell, my parents weren't even born 50 years ago. I know that. And had I gotten a job as a teacher, which is what I was being trained to do, also with no training on any of the issues that you brought up, it could have been a much different story, but I didn't, and took a job as a welfare caseworker in 1973. Spent a couple years doing that. That included, by the way, making home visits to all of our clients. So it was a real eye-opener. What I didn't know then, because I saw some very, very difficult situations, I didn't know that was the best we'd be treating poor people for the entirety of my career. That was the best we would treat them. The truth of the matter is back in 1973, the amount of money we gave people on welfare and cash assistance and food stamps brought them up to 80% of the poverty level. 80% of all poor children got some kind of welfare. It was certainly, there were some terrible, terrible other things happening in the world then. But in terms of the financial assistance that we were offering to people, we've never done that well since then. And the application that we took from poor people at the time was 3 pages long. It was entirely a self-declaration. People did not bring in documentation for what they told us we believed them. The food stamp application was 2 pages long, right? This is early 1970s. Our fraud rate was about 6 or 7% then, the same as it is now. When we just trusted people, the fraud rate was not any different. Since that time, we could not treat people any more like criminals than we do now. People apply for assistance. We presume that they're lying to us. I know this because I administer the agency that applied these rules. Some of you may not know I've directed the welfare department for over 30 years. We presume that they don't want to work, which is why we have to have work requirements. We presume they're lazy. It's built into our system. We presume they're liars, they're lazies. We presume that they don't really care about their children. I mean, one of the things that's always baffled me about a work requirement is the reason people work is because they love their families and their children. There's no means test on loving your children. We don't need a work requirement because people who have children want a better life for those children. All these people. We treat them as though they don't. And that's the kind of response you get from Stephanie's situation is the culmination of decades of us creating a means-tested public assistance system, which basically presumes that people are lying to us. We treat them that way. We presume they don't want to work, that if we don't make them, they won't do that. That's what I see when I hear her and I see where we've ended up now, that we are actually worse off. Now, on the good side, all of you, all the people, I can't imagine having had an event like this in 1973 and this many people showing up. I think that there are so many young people now who are so smart and care so much about each other, and that we are so much more awake about issues about diversity and other things, other issues, that, the chance for us to do this better is better now than it's ever been. And I think that that's what's encouraging me is all you folks. So thank you.
Thanks, Jack. I wish we had an hour for each of you. I could listen to all of you for a very long time. We don't have an hour, we have 8 minutes. So we're gonna just kind of zip through one more question for each of you. Leah, could you talk a little bit about how shelters and DV programs work together with other agencies in our network of care, and what are some challenges in the system?
Yes. One thing that I love about working at my sister's place is we have a very driven team committed to helping reduce barriers and creating access so our shelter residents can receive the support they need to heal and move forward to their best next. Our staff has successfully established partnerships with other agencies to help with this space, but unfortunately, there are always challenges to continue to navigate. One really good example is we have a phenomenal working relationship with the Athens County Department of Job and Family Services. We've established special voucher programs for domestic violence shelter residents, including a basic needs voucher to help access basic needs items like clothing, and a housing related voucher to help furnish a new house or a home when housing is obtained. These voucher programs have helped tremendously, but unfortunately are only available to those residing in shelter who have kids. If you don't have children, or your children are not staying with you in shelter for any reason, you cannot access these vouchers, and access to resources is much more limited. Our staff works very hard to provide a balanced support for everyone residing in shelter to meet all of their basic needs. But looking through a selection of lightly used donated items, of a limited selection, is very helpful. But it's not the same as being able to go to a store and say, these are the items that I feel I need to be successful and heal and move forward. Another very big and common problem we see is related to housing accessibility. In Athens, we have a couple different types of housing voucher assistant programs designed to help homeless low-income folks obtain affordable housing. But each program has their own stipulations that need to be met. In order to qualify for some of these housing voucher programs, you need to be documented HUD homeless. The HUD definition of homeless does not include couch surfing. If someone does not have a place of their own, but they're able to bounce around with friends and families, they're not considered homeless and cannot access these vouchers. Shelters are often full and hard to get into, leaving people with very limited options. And although these individuals can still apply for a Section 8 HUD voucher or subsidized apartment complexes, these programs often have very long wait lists. The other very big, commonly encountered problem with housing is finding landlords who are willing to accept these housing vouchers. Housing vouchers have very low limits on how much rent and utilities can cost. And a lot of landlords don't want to lower their rent to accommodate a housing voucher. And some just don't trust the person seeking housing, maybe based on a previous bad experience with the tenant. We're all human and we all face challenges in our day-to-day lives. And it's easy to get caught up in the day-to-day and forget that those around you might be having a hard time too. On a small but very impactful scale, I ask everyone to try to remember that you never really know what somebody else is going through, to treat everyone with kindness and respect, and to start by just believing them. And on a larger level, I would love to see funding sources and voucher programs review parameters to improve access and meet the realistic needs and circumstances that we encounter every single day.
Yeah, well said. Thank you, Leah. Karen, what guidance do you have for students who might be pursuing the helping professions in terms of what they should be prepared for when entering the workforce? How can incoming professionals contribute to reducing the stigma of poverty and accessing systems?
Well, my dissertation topic looked at Appalachian women, poverty, and how that impacted healthcare. And over again, as I rode with the College of Medicine's mobile health clinic, I heard the same things over and over. We're judged, we're lazy. One lady said, I just want you to know I work really hard. I am not a lazy-assed woman. And I said, I've yet to meet a lazy-assed woman in my entire 2 years of riding on this mobile health clinic. What we don't realize, I think, as professionals or even sometimes as professors, our students come to us with food insecurity, especially if they're from this area. I had a student last year who was living in her mom's basement in Albany, no internet connection. And so the only way, and this was one of the most amazing students I've ever had the pleasure of teaching, the only way she could do her homework was to drive into Athens. That needed transportation, which needed money for gas. And so know that people try, but sometimes I say offer some mercy and grace, especially with my students. Understand that they are bringing, as Robin said, they're bringing their backpacks full of trauma and drama. And we have to understand and take the time to reach out and say, what can I do to make you successful in this class? How can I help you be successful in this job? Understand that oftentimes they don't have the wardrobe. They don't have the money to buy clothing to dress appropriately for the job. They don't have money for books. They don't have money to get to a job. Childcare. One of my students works at a childcare center and parents have to pick them up at 5 p.m. I don't know about y'all, but when I worked, I didn't get off till, if I was lucky, if I got off at 5 p.m. and they're expected to pick their children up. So we look at these systemic issues. So I would tell my students, this is in your hands. The future is in your hands. We need to make policy changes because even for women to use the mobile health clinic's free services, they have to be below poverty level. Mm-hmm. And if they're not below poverty level, they don't get medical care. We have a healthcare provider that if your child got injured and you took them and you didn't pay your bill fully, you cannot get a free mammogram with the voucher provided for you by the College of Medicine because you still owe money for your child. So we need to work on systemic issues. We need to ask people, as Stephanie said, what can I do to help? And sometimes it is the people that work at the College of Medicine would often give gas vouchers for people. They would drive their own personal cars to deliver insulin to patients that they knew could not get it any other way. And so we, as a people who are privileged and blessed, we need to embrace people and say, how can we help you succeed? Mm-hmm. Sometimes that takes very little other than a hug and a smile and maybe a good meal.
Yeah, thanks, Karen. Robin, along those lines, what guidance can you share with education students about the field they'll be entering soon? Any classes, books, other resources you could recommend beyond those that they're pursuing for their major?
So I think one big piece of advice that I would give would be to really truly believe that parents always want what's best for their kids. And that looks different for every family. And it's not going to look to them the same that it's always going to look for you. Like, just because you think one thing is the best for that kiddo doesn't mean that that's the top priority for that family. And don't judge them for that. Like, parents always want what is best. And even though we might be the expert educators, they are the expert on their child, and they live with that child. They love that child. And yes, we all have to look out for those kiddos that need us to look out for them. But if we truly believe that the parents have the children's best interest at heart, that helps to build that relationship with the family and break down the barriers that might be happening because of their past experience and education. I mean, that whole family, the whole generation after generation might have had a negative experience in school and might have barriers built up. And so therefore they might come across as being very belligerent, for example, on any given occasion, and they might blame you for a lot of different things. But if you sit and really listen to them and believe that they want what's best for their kiddo, you can build that relationship and you can help to bridge that gap. And I also think it's really important to make sure that you understand that poverty looks different for different families. I mean, I know for a fact we have a very impoverished family, and those kiddos, like, you look at those little boys bouncing into the building every day and they're just as happy as can be, and they're clean cut, haircut, got their cute little outfits on, and you'd think that they'd come off of, like, I don't know, some fancy street here in Athens. Well, they didn't. They came off of Bigly Ridge in Meigs County. And then you also have poverty families that the kids come and they look dirty, and like what we put the face of poverty, what we think it's going to look like, the stigma piece. But you don't ever know, like, it can look very different. And so it's really important to keep your ears open, your mind open, your heart open, talk with families, and just do what you can to help. And we keep saying that, but I think it's so important to just be open and honest. And also, and to get information, I absolutely try to get any and all hands-on experience that you can in classrooms and make it authentic. Immerse yourself in those experiences. Don't just sit back in the back of the classroom and watch and observe that teacher. Get to know kids, get to know the teachers, and become a member of that classroom that you're in. So important to really start to build those relationships and understand people. Get educated on trauma-informed care. Really important to understand restorative discipline and restorative justice. Really important to get all kinds of information that you can about poverty and what it can look like.
It's great advice. Thank you, Robin. All right, Jack, we're giving you the last word here. What would you like to see change in our local, state, and federal governments and the way our tax dollars are used for social programs? What's your ideal scenario?
Oh, let me think.
How much time do we have?
Yeah. I can make this really brief. Poor people need more money. I mean, this is the most obvious solution in the world, but what they really need is more money. I mean, it's something that we almost are afraid to think about. But I can tell you already that any health interventions you have, any educational interventions, anything you're trying to do to help poor people would not be as severe of a problem if they had enough money to meet their basic needs. I mean, in fact, it's just the opposite. Almost none of those things will work for people who are not having their basic needs met. I mean, it's an irony to me that for criminals, we will guarantee them a roof over their head, food in their mouth, medical care. We'll guarantee them all those things. But if you're a single mom out there with a kid, we will absolutely put you in the street because you didn't fill out a form right, or you didn't show up for an appointment without a roof over your head, without food in your mouth. We will deny you medical care. We will absolutely do that. And I know that because I administer the agency that did that to people. So what they need is more money, which means minimum wage has to be a real minimum wage, which means SSI benefits. SSI benefits are set at 75% of the poverty level. We take people who are old and disabled, we give them 75% of what we know, they need. That's just to be at the poverty level. Welfare benefits now, cash and food stamps will bring you up to half the poverty level. If your income level isn't below half the poverty level, you can't even get a dime cash assistance. And in most places, you can't get any at all. Somehow we've convinced ourselves that we bought this lie that giving poor people money hurts their character, that they have a character flaw. Oddly enough, I don't know anyone, excuse me, who sent back their COVID check and said, you know, if I get this money, I just know I am just not going to want to work anymore. I'm going to go buy drugs. I'm just going to do terrible things. I'm just going to send it back to save myself that grief. We don't really believe that when it comes to us, and we need to stop believing that about poor people. They need enough money to live on. And I think for those of us and those of you who are going to work in this field, that's a message. And you will see this as you work with poor families. You will realize half of what you're spending your time on is helping them get tampons, is helping them get diapers, helping them get a ride somewhere. All these are things that people should be able to reach in their pocket and pull out money and buy at the store. I think that's what I hope for.
Yeah, great. Thank you. All right, we're out of time. I've learned a lot. I hope you have too. Many thanks to all of you for taking the time out of your day for this. All right, be safe on the way home.